Chinese health authorities are still working to identify the virus behind a pneumonia outbreak in the central city of Wuhan. China has identified the cause of the mysterious pneumonia outbreak in Wuhan city, and it's from the same family that caused the deadly SARS epidemic 17 years ago. It's a new type of coronavirus.
People have already died from this illness, which has spread to at least 3 other Asian countries.
Well, South Korea has reported its first suspected case of a mysterious pneumonia-like illness that's been spreading in China.
Now to growing concerns about the deadly coronavirus officially hitting the U.S. Here's what we know.
3 cases have been confirmed in France. That's the first time the virus has been identified in Europe.
The Philippines reporting the first coronavirus death outside of China.
The World Health Organization says the risk of the virus expanding worldwide is now classified as very high. And there are new cases of the disease here in the United States. 16 cases so far have been detected and confirmed in the U.S.
The virus first reached sub-Saharan Africa.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
We can learn from countries who are ahead of us in this outbreak. Extensive testing, isolating those who are sick and their contacts, and physical distancing are crucial to suppressing the spread of the virus. Wait too long to do that, and it's too late.
While Canada reached 120,000 tests this week, Germany is testing 120,000 every week.
Wir haben es früh erkannt.
We detected it early, says this senior health official, because we tested it early.
The critical period of days is measured after a country reaches 100 confirmed cases. Canada reached that date on March the 11th. Since then, the cases have surged past 1,000, 2,000, towards 3,000. And the curve is bending upwards. Japan has done a better job than most countries of flattening the curve, attributed by some to a mask-wearing, obedient population. Other countries have been at this much longer. Canada has a fraction of the number of cases of China, which is over 80,000. South Korea managed to bend the curve down with a massive testing program to below 10,000. Italy didn't get started soon enough. Same thing for Spain, and maybe most worrying of all is the United States. All of these are arcing upwards, which suggests that cases are doubling more quickly.
The frustrating thing about all of this is it really just feels like it's too little too late. Like we knew it was coming.
One of the forecasters said to me, we were looking at a freight train coming across the country. We're now looking at a bullet train because the numbers are going up that quickly.
Today is kind of getting worse and worse. We had to get a refrigerated truck to store the bodies of patients who are dying.
Emergency calls have hit their highest levels since the attacks of September the 11th. Hospital staff are describing a tsunami of patients flooding their emergency rooms.
This is how one intensive care doctor in New York described the scene at his hospital.
Hell. Biblical. I kid you not. People come in, they get intubated, they die, the cycle repeats.
Leaders in various offices, from the president to the head of health and hospitals, saying things like, we're going to be fine, everything's fine. And from our perspective, everything is not fine. I don't have the support that I need and even just the materials that I need physically to take care of my patients. And it's America, and we're supposed to be a first world country.
Coronavirus infections have passed the 500,000 mark worldwide tonight, with 23,000 deaths. And the United States now has more than 82,000 cases, more than any other country, including 1,100 deaths.
Is that we do not know how many cases there are, because inexplicably we have not been testing nearly enough now for at least a week and probably longer. As The Atlantic put it, the official coronavirus numbers are wrong and everyone knows it. And that is true. Every expert I have talked to, from doctors to epidemiologists to public health experts, they are tearing their hair out of the fact that we do not know how many cases there are.
Basically, you seem to be saying, because you can't name anyone specifically, that there's no one specifically in charge that we can count on to make sure that people who need to be tested, healthcare workers or anyone else, there's not one person that can ensure that these tests can be administered. Yes or no?
My colleague is looking at me to answer that. Here we go.
Okay.
All right. So,
and I do have another question, so if we can kind of get
so very
the
quickly, the system is not really geared to what we need right now, what you are asking for. That is a failing.
And failing, yes.
It is a failing. I mean, let's admit it. The fact is, the way the system was set up is that the public health component that Dr. Redfield was talking about was a system where you put it out there in the public and a physician asks for it and you get it. The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes.
It's a serious thing that needs to be dealt with seriously. And right now, the federal government is failing. They are failing to do that. And they appear to be failing for a reason. The reason is the person at the top of the federal government does not want to deal with the problem.
Dr. Fauci said earlier this week that the lag in testing was, in fact, a failing. Do you take responsibility for that? And when can you guarantee that every single American who needs a test will be able to have a test? What's the date of that?
Yeah, no, I don't take responsibility at all.
And the president was asked why his administration disbanded the National Security Office set up to prepare for pandemics.
When you say me, I didn't do it. We have a group of people. I could ask perhaps my administration, but I could perhaps ask Tony about that because I don't know anything about it. I mean, you say we did that. I don't know anything about it.
Well, I think for anyone who's in the cancer community, we all are feeling the same in that we're scared.
7 of those 9 deaths in Washington state came from inside the same nursing home. That may cause some concern for those who have loved ones in these types of facilities.
As people are being carefully removed from the assisted living home and put onto wheelchairs or mobile stretchers.
I'm just gonna fight this. So once again, don't take any chances.
When you say the Americans were scared, though, I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. We've distributed vast numbers of ventilators, and we're prepared to do vast numbers. I think we're in great shape. I hope that's the case. I hope that we're going to have leftovers so we can help other people, other countries.
Who needs one will be able to get a ventilator?
Look, don't be a cutie pie. Now, the virus that we're talking about having to do, a lot of people think that goes away in April with the heat. Because of all we've done, the risk to the American people remains very low. People die from the flu, and this is very unusual. And it is a little bit different, but in some ways it's easier, and in some ways it's a little bit tougher. It's going to disappear. One day it's like a miracle. It will disappear. And from our shores, it could get worse before it gets better. It could maybe go away. We'll see what happens. Now the Democrats are politicizing the coronavirus. You know that, right? Coronavirus. And this is their new hoax. You take a solid flu vaccine, you don't think that would have an impact or much of an impact on corona?
No, he's asking the question, when is it going to be deployable?
We have a report today, the global death rate at 3.4%, and a report that the Olympics could be delayed. Your reaction to that?
Well, I think the 3.4% is really a false number. Now, this is just my hunch.
So we were really surprised that's happened over the past week. It will be interesting to see if that continues. I think a lot of people only now appreciate how clean cities can be, and it's up to us to demand what we want from our governments in coming back to going to keep it clean.